Picture this. A family has just been told their father has had a major stroke. They are standing in a hospital corridor, trying to absorb what the doctor just said, while a trolley rattles past, an overhead announcement crackles, and two nurses have a conversation 3 feet away. The doctor wants to answer their questions. The family wants to ask them. But there is nowhere to go. No free room, no quiet corner, just the corridor. That moment, that failure of space, happens dozens of times a day in busy hospitals. And it costs something. It costs the family their dignity in a devastating moment. It costs the clinician their ability to communicate clearly. And it costs the patient, because rushed conversations lead to missed information and weaker follow-through on care. Now here is what is interesting. The solution might not be a new building. It might not even be a new room. It might be a box. Over the last few years, something quiet but genuinely significant has been shifting in how hospitals think about space. And it starts, of all places, in corporate office design. You may have seen them. Sleek, freestanding pods sitting in the middle of open-plan offices. Self-contained, acoustically sealed, no construction required. Total privacy, just plug in and go. Tech companies love them. Co-working spaces are full of them. And now, slowly but surely, hospitals are catching on. Because the fit is almost too obvious. We need private spaces for breaking bad news. We need quiet corners for teleconsultations. We need somewhere a clinician can step away after a difficult case, breathe, and come back to work. We need all of this constantly, in buildings that were designed before any of this was a priority. A pod fixes that, without a single brick being laid. A pod near the ward becomes a family counseling space. A pod with a camera and good lighting becomes a teleconsultation suite. A pod near the intensive care unit becomes a place for a nurse to sit quietly for 10 minutes after losing a patient. The same piece of furniture serving completely different clinical needs across the same working week. From a management perspective, the numbers make sense too. A pod costs a fraction of a new room. Hours to install, not months. Relocatable as needs change. No structural work required. And for the Indian context specifically, manufacturers are now designing pods with active air conditioning built in. Because a soundproofed booth without cooling in a South Indian summer is not going to be used by anyone. Globally, clinical telehealth pods are going even further, with embedded diagnostic devices, sanitization cycles between patients, and AI-assisted triage. Deployed in pharmacies, rural outposts, and community centers. Not prototypes. Live infrastructure. India has one of the largest gaps in the world between specialist supply and patient demand. We cannot bridge that purely by building. We do not have the time, the land, or the capital. But we can think differently about the spaces we already have. Make them work harder, smarter, and more humanely. That family in the corridor deserved a room. And for less than the cost of a decent piece of medical equipment, a hospital can give them one. Sometimes, the most human solution is also the most practical one.